then slowly familiarize ourselves with the terminologies and concepts. Then we'll be going through the claims process because claims process is the core of the healthcare. No matter in which healthcare company you work for or a healthcare provider you work for, claims is a process they use it, and it's very important that you understand the claims life cycle. How does it generate? What does it happen? What are the different stages? What are the different adjudication processes? What are the different statuses? Who sends it? Who receives it? What are its contents? So everything we will be going through the complete claims process, and what are the different transactions that are involved in the claim. So all those things we'll be talking about. Then we'll be talking about the pricing models too, how the pricing is done. What are the different models that are involved? What are the criteria and conditions in which the billing is done? Then we'll be talking about the spot cancel and what is this all about? There's a HIPAA transactions and they came out with the standards, and those standards are currently 4010, and whole industry, healthcare industry is moving towards the implementation of 5010 format. So we will be talking about that too. And then next important wave of changes that's happening in the healthcare industry is the ICD-10 changes. So right now there's a gap analysis or a readiness is being done this year. So come next year onwards, once the 5010 is implemented, so everybody will be moving towards implementing ICD-10. So it's basically a coding system that helps diagnosis. Currently it's called ICD-9, meaning version 9. So we are moving on to version 10. So we'll be talking about version 10 as well, so that you are familiar with Watch 10, you are familiar with ICD-10 concept, then you are familiarized with the claims process. Then also we'll be talking about this Medicare and Medicaid, because the majority of the claims processes or any healthcare payer would be processing with Medicare and Medicaid claims. So these are the government plans. Medicare is by CMS. CMS means it's Center for Medicare and Medicaid Services, and Medicaid is sponsored by the state government. So we'll be going through those plans as well. And then what is the process of submitting these information to the states and CMS? So we'll be talking about the submission process. Then there is a compliance process. Then we'll be talking about the government regulations and guidelines, because Obama Healthcare has brought in several initiatives. Some of those initiatives are like implementing the government plans, like providing some insurance to uninsured, and also the Obama plans are encouraging early retirement so that they can get the benefits too. So we'll talk about those initiatives. We'll talk about some of the initiatives as part of these government guidelines. Then at the end of the sessions, I would like to show you, in case some of you have, in case you have not seen any real-time BRDs like business requirements or a test cases or even like a charter or a business cases. So I'd like to show you my project, to show you this is the way the requirements are documented. This is the way the charter is documented. This is the way the test cases are documented. And as a business analyst, when you're at work or when you're at a project, this is how you try to implement it. This is how you try to build the business cases, use cases, test cases, so that you get a good idea of what to expect when you get onto the work. So that's the purpose of it. And in the meantime, I'll be giving you some exercises so that you can work at in between when you get some time between the classes. So that's the structure of this course. So if you have any questions, please let me know. That any particular item that we need to talk a little bit more, or if something that you thought about it and it's not covered here, and if that is possible, yes, we can certainly include it. Otherwise, probably you won't be able to do that. So let me know if you have any questions. So this is a further breakup of 5-day program on a day 1, day 2, day 3, 4, and 5. So on a day 1, that is today, we will talk about what is health insurance. Then we will go through what are the different components that make up a health insurance. So we all know about our auto insurance. Probably everyone has it, and you might have some idea about health insurance as well. So let us discuss about different coverages and also different plans, the type of plan. And also I want to introduce you some terms that you will be predominantly using during this particular course, and also the terms like a provider, the payer, the NPI, or a taxonomy. These are pretty much used, when you get onto any healthcare project. So we want you to, get a thorough understanding of these terms. And here is the agenda for day 2, 3, 4, and 5. So that's what we will be covering as part of this course. Okay, so let's talk about what is a health insurance here. So everybody understands what is a basic term by means of insurance, right? Simply put it, health insurance is nothing but it's a protection, against cost. If it's your auto insurance, it's a protection of your against your auto in case of any eventuality of an accident. But here in health insurance, it is protection against the medical cost. So health insurance is a policy or it's in a contract between two parties, like insurer and an employer and a provider. And it's an individual or a group, in which an insurer basically is an insurance company. It agrees to provide a specified health insurance at an agreed upon price. So that's what is part of an agreement, which we call it as a premium. We pay as a monthly to these insurance companies. Depending upon your policy, the company that you work for, your premium may be payable either in a lump sum or in installments, depending upon the type of an agreement that you have between the employer and the provider or the insurance company, right? So health insurance usually provides a direct payment or a reimbursement. You would have probably seen, it gets deducted from your payroll. Or if you have your own insurance, then you have an arrangement to get it directly deducted from your bank account. So whatever may be the mode of payment, you will be paying a monthly premium, right? So to your insurance companies. So this is what meant by an health insurance. So basically, we are trying to minimize the risk of medical expenses, right? I mean, everybody can fall sick. I mean, these don't come, you can't predict. I mean, if there is a hurricane, yes, you can predict it. And if there is any other calamities, yes. But if there is any risk that is coming in, so you can only plan for it, take some precautionary measures so that, you can take some preventive care to minimize the risk. So otherwise, it's not actually in your hand. So in order to mitigate the risk of your health costs, that is the reason that you want an health insurance. So that is, so there is a benefit of taking an health insurance. Basically, you're getting administered by a central organization, whichever is the agency, whether it's a Medicare, it's a Medicaid, or if it's any other HMO or a PPO or any other plan that you are with, right? So that's the benefit that you're getting it. But at what cost? It is a monthly premium that you're paying every month to the company. So it's a basic understanding of an health insurance, how it works. It's similar to your auto insurance, but auto is on your, whether your AAA or your State Farm. And similarly, the health insurance companies, like your Blue Cross, your Aetna, or your Cigna, or your Kaiser. So any one of these companies offer you a plan, to provide health insurance for you. So there is, we have seen what is in health insurance, but there is a need for health insurance, right? As we said, health insurance is to minimize the risk of your medical costs. So you can't anticipate your costs, but you can definitely plan to mitigate the risk of how much expenses that you can incur, right? For example, if you are a newly married couple, so you can plan for your expenses. If you're planning for a family or a baby, right? But if you are already having a baby now, and it has, if he or she is in infant stage, definitely there would be medical expenses for at least for another couple of years with all the regular checkups, the shots that you need to provide. So there is a cost to it. So to some extent how much would be your cost. So in order to have those costs taken care of, you should have a proper plan you should have your proper insurance coverage to provide that kind of a services to you, right? So that is a need for you to have a health insurance. That is, you should be having a proper and a timely medical care in case of an emergency. So that's where your health insurance comes in. And at the same time, the insurance companies, like if you are part of an HMO, they also try to stay you to be healthy, by encouraging you to have some precautionary measures, regular annual checkups, so that you can preventive care is always better. Prevention is better than. Does someone have any question?
I don't.
No question, right? All right.
Hello?
So I was saying that staying healthy by regular and routine checkups. That's where these HMOs and PPOs, they encourage you. Prevention is better than cure. So that's the reason they provide you all such a measure, so that in case of anything happens, so you already know before the issue comes up. So that's the need for having a health insurance. So what do you need to know? So we said that yes, what is meant by a health insurance, and we also talked about why do you need to know, why do you need to have a health insurance. So we have seen some benefits of having health insurance. Then to have an health insurance, what is the information that you need? So certainly you need to know, what type of plans you need to have, right? So for that, we need to understand what are the types of plans are out there in the market. For example, if you are an employee, probably you may not have much of a choice, because whatever your employee offers, you'll be taking it, right? But in case you are on your own, you have your own independent business, or if you have your own company, then you need to go and search in the market, what plans that work for you. So let us talk about, some of the plans that are predominantly offered by these health insurance companies. So we will study a little bit about these HMOs, PPOs, and POS, and try to become familiar with them, right? So when we are studying these HMOs and the different plans, we will also see what are the provisions in which these different plans are offering, so that you have a better understanding of them. So let's study some of the key components of healthcare domains here. So the reason I'm giving some 7 points here is, like, in case you are part of your project and you are working on a product or a plan administration or an enrollment where you are implementing some new initiatives. So you need to understand what these key things are needed. If someone is asking for a new plan, right? So the first one is you must have. That means the must-have thing. So as you said, you can't foresee a certain injury or illness, but you can always anticipate some medical needs, right? So the medical expenses. So not all the policies provide maternity coverage. So it is our first question that we need to ask any agent or an insurance company that are you providing maternity coverage? Are you providing any coverages that, for example, if you have a disabled kid, then you need to know, are you providing for an existing condition? Right? So those things that you need to ask your agent upfront. So look for these must-haves that you must need in your insurance plan. Because if you're starting a family, as I said, and then another example is some insurance companies deny the coverages to the kids with pre-existing conditions, right? So if you have an asthma for a kid and if you're going for a new plan, then you make sure that these existing conditions are covered. So it's important that you need to know what these must-haves are, and that you need to have a coverage for it. And the second important thing is the cost of the basics. So just as it does not mean make sense that if you want a luxury car, and your monthly payment can't be at a minimum, right? So if you're looking for a big car like a Cadillac, then obviously your premium would be higher. Similarly, if you want a cost at a certain limit, then you need to have some basic coverage, at least covering that, right? So it's important that you need to understand what are the coverages that you're offering and what is the premiums that you are paying. You would be paying it, so it would be directly proportionate to it. So you need to understand on what you're getting for what you're paying for. So the third point is your provider network. See, the healthcare industry, all these providers, they operate in terms of a network. They form into groups. The physicians get together, or hospitals, and there is a contract between your employer or your provider and your payers. That's what these HMOs, EPOs are called for. So we need to understand, is my service provider part of this contract or not? So that means if you have a primary care physician, that means that's where you take your kid for all your healthcare needs, or you go to him. Then you need to know if your favorite specialist that you like, whether he is part of the plant network or not, because the policies generally cover a lower share of the cost of out-of-care network, or not cover it all. So you need to understand, what covers, what does not cover. So whether he is in network or any particular services that is providing, whether it falls under out of network. So those things that we need to keep in mind when we are looking for a new plan. The fifth one, what I'm saying here is the prescriptions, right? For example, everybody needs a drug, or if you're on a medication, then you have to make sure that your medication is covered under prescription. If so, what is the copay and all? So that's another important thing. Then your annual limit. See, there are some limits. Every coverage has certain limits, like a lower limit or a higher limit. Like, for example, there are some deductibles, right? So normally there would be some deductible like $400 or $500 per year per member, or it is $1,000 per family. I mean, I'm just throwing some numbers here, but there could be some limits like that. So you need to know what are those annual limits in which that, to some extent you are responsible, and beyond that, the insurance company is responsible to provide you the reimbursement. Then you need to know the dependents also, like is it covered for your dependents? So these are some of the questions that you will be asking about yourself. I mean, it's not that you'll be asking yourself, but if you're on a project, as I said, that if you're implementing any new product or making some enhancements to your product or a plan administration, or if a company is coming up with a brand new plan, then these are the questions that you need to ask as a BA to your business subject matter expert. So that's the reason that we are putting out here, so that we don't forget it. Any questions so far? We just started off with some basics, like what is an health insurance and what are its components. All right. So just to show you, I know most of you all are familiar with all of them or some of them, but at least the key players in the healthcare industry, as you see, there is Blue Cross, and there is United Health, there is a Kaiser here, there is a Celtic here, just to show you. And if your insurance company is one of these, then it's fine. Otherwise, there are a lot of insurance companies, in the country. There are around 3,000 insurance companies, in the country. So it's a very, very wide, big market. And just another interesting point that I want to show you is these are the top 10 insurance companies in terms of numbers they provide. So the first one is United Health. Then United Health is a Minneapolis company based out of. Then there's a WellPoint, Kaiser, Aetna, etc. It is just out of interest in case you want to know, who are the top 10 players in the industry. Yes, these are. Just to want to give you an idea, like for example, if this one is for a Blue Cross insurance company, what are the different products they offer, right? So the first one is your individual. If you're individual, they provide you several plans, that can, meet your requirements. It could be for a single, if you're one single person, or it could be a family, right? So the plans for those, who do not have an employer-provided coverages. So that means whether you have an employer, then there's a separate plan, or if you're single, then there's a separate plan. Then you have a Medicare plan here. Then similarly, Medicaid, even though it's not shown here, but these are the government plans. Then the employer-provided plans. Different employer groups are there. Then they have some customized plans. Then on the right side, you're seeing some other products here, like HMO, then the Blues prescription, then there's a dental plan, then there's a vision plan, and similarly, there is an other plan as well. So these are the different products, in insurance companies. So I would strongly, suggest you all to, pick up your own plan. Whoever is your insurance company, try to do some research in what plans they offer, so that you have an idea of, what are the different plans are offered, and also, you can take up your own medical plan and see what coverages do you have, how much is your copay, how much is your deductible, and what are the different exclusions, inclusions are covered, out of curiosity. Since you're studying the healthcare, I think that's the minimum thing that you should be aware of, at least for our plan is considered. So let's talk into some of these terms here, because we will be using left and right, the different terms here. And if you have any question at any point of time, it would be difficult to follow, if you're in any meetings with your subject matter experts, and they expect you to know some of these terminology, because as a BA, when you're put on a project, you will be considered as a knowledgeable in healthcare. So many SMEs may not take time to explain to you, but it is expected of you. So let's talk about these terms here. Premium here. It's an amount the policyholder or sponsor, pays to the health plan to purchase the health coverage. That is your monthly premium, or whatever the frequency is. So it is some fixed amount that you pay, whether by means of your employer, or you directly pay to your payer, but it is that premium that you pay. That is the cost for your health coverage, right? So if you remember that, the premium that you pay, for example, if you're part of a company, if you are paying around $300 for a particular plan, there is some amount even your employer also pays. So both X amount and Y amount put together is your actual premium, for a particular coverage. Then there's something called deductible. It is the amount that the insured must pay out of pocket before the health insurance pays in. That means when I say you have a deductible about $500, so every time you make an office visit, or you go to any checkup with your kid, if he has any ear pain or anything, so all those costs would add up to $500, for example. And once the deductible is reached, then only your insurance company will reimburse you the cost for your health care. That's what it means by the deductible. Okay. Then copay. Copay is the insured person must pay out of pocket. The meaning of out of pocket, that means you are bearing the cost. So it is the patient's responsibility to bear the cost of your health care. So there's a $10, $20 co-payment based upon the plan that you have signed up with your employer or with your insurance company. So it's better you have an idea of what is your copay, what is the premium that you're paying, and what is the deductible that your plan is providing to you. I think these are the common terms that most of you all might have familiar with, but in case you're not, so want to touch up. Any questions so far? Continuing on those terms, there's a co-insurance. Just like a co-pay, there's a co-insurance is also an out-of-pocket expense. The only difference is co-pay is your fixed amount, and co-insurance is always a percentage of the cost of the particular office visit. Okay, so most of the times, it is like a 20% like that. For example, a member might have to pay 20% of the cost of the surgery over and above the co-payment, right? So that means up to 20% you will be paying, and you will be paying your co-payment, and then the remaining your insurance company would be covering. So that's the difference between your co-pay and co-insurance. It's not that there is always a co-payment and a co-insurance. There may or may not be on any particular plan. So there are more terms I'm covering here. The next one is exclusion. For any plan, it's not all services are covered. So there are some, the insurers are generally expected to pay the full cost for non-covered, meaning there are some services, for example, if you are having any cancer, or if your kid is suffering with some disability, there are some coverages that your insurance company may not cover it, right? So that's number one. And the second thing is, in case your insurance company covers, but due to some reason you're traveling or you're seeing some physician who is out of the network, and then those services are also not covered by the insurance company because it's outside of your network. So these are the couple of reasons why it's important. You need to know what are the exclusions, because you should not be surprised when you get a bill, like when you get your statement and these services are not covered because they have been excluded, right? Then we need to know the coverage limits. So there are some coverage limits like a lower limit and an upper limit, like for a deductible or some of the benefits that they have reached during the course of the time. So you need to understand what those ceilings are, what is the minimum and what is the maximum. Okay, and there is the out-of-pocket maximum. Similar to the coverage limit, the insured pays the full cost. So out-of maximum can be limited to a specific. That means, for example, if there is out-of-pocket ceiling, then you need to know what is the ceiling is. That means you cannot exceed more than that particular ceiling by the insurance company. Anything more than that, your insurance company pays. But as a policy holder, you need to know what is the out-of-pocket maximum the company is offering you. There's a term called capitation. Capitation is an amount paid by an insurance company to a healthcare provider, for which there is an agreement between these two parties, right? That means every time when we go to a doctor, we don't know how much the insurance company is paying to the particular physician or hospital, right? Sometimes it is on an actual, and sometimes it's on a fixed amount. That means whether you go and what are maybe the cost of the healthcare service, the payer always pays a fixed amount to the hospital or physician. That payment of a fixed amount by the payer to the provider is called a capitation fee. And if there is agreed upon fees for a particular visit, then that fee is called fee for service. That means only when you visit a physician, the insurance company is paying to the particular physician or a hospital, right? So these are the two types of payments in which a provider pays to the payer pays to the provider. Means an insurance company pays to a hospital. One is a capitation fee, and the second one is a fee for service. So it's important that you understand the definitions of these two terms. Again, capitation is a fixed amount. No matter whether I go to a hospital or not, my insurance company pays to the hospital. That's number one. And the second one is only when I go and see to a doctor, my insurance company pays to the hospital. That's the second instance. So I put in a very simple terms so that you can understand what is meant by capitation fee and a fee for service. And if you take this definition further, the government pays for this Medicaid and Medicare, right? So anybody who is on a Medicare or a Medicaid, so government will not pay on each and every member or each and every case in which the patient sees a physician. So there is a fixed amount always the government pays. In some cases, it's a capitation fee. There always a hospital, for example, or an insurance company like Blue Cross. They get always paid, every month, the fixed amount, whether Medicaid holder go and see a physician or not. So they get a fixed amount anyway. And the second type I'm saying is a fee for service. That means whoever is on a Medicare or a Medicare, he goes and sees a doctor, and then the companies like a Blue Cross, they reimburse from the state or center. So that's the difference between the capitation and fee for service. Continuing on our terms, we talked about in-network and outside network, right? So the same in-network provider. So he's anyone who is a healthcare provider on the list of the provider list. So I said the network is a group of physicians or a group of hospitals. They form a network, and if any physician who is practicing is within this network, then there is a certain amount of coverages. If he's outside of the network and you go and see, then your coverages are not as per the agreement, and hence you will end up in paying more co-insurance and co-payments. So that's what it's important that you need to know your in-network and out-of-network providers. Then there's something called prior authorization. For example, you see your own physician, for example, he's your pediatric, and you have identified him as a PCP, like a primary care physician. But due to some reason, your child needs some special services and you need to see some other doctor. So in that case, if you have to see some other doctor, then if you don't have a prior authorization of the insurance company, then your cost is not paid. That means in case there is a need for you to see some other specialist, then you need to obtain a permission from the insurance company saying that you are seeing your primary care physician, but due to some specialized services that are needed, you need a reference of your other specialized surgeon or a doctor, right? So that is called a prior authorization. That means your primary care physician has to refer a surgeon, then only the cost incurred by the surgeon will be reimbursed. So that's the meaning of prior authorization. Then with explanation of benefits, I think most of you all would have seen the statement that comes to you by the insurance companies. That basically explains, how the coverages have been distributed, whether it has been covered, how much has been your responsibility, the patient's responsibility, and how much has been covered by the insurance companies. It's basically explaining you the amount they have charged. Any questions on the definitions that we have seen so far?
Raghu, this is Suresh here, please. As far as till now what you have covered, I have a simple question, like these components of healthcare domain for BS, what you're covering, are common points for all the insurance plans and insurance companies, right? Correct. They don't change depending upon each insurance company, and they don't change based on the provider too, right?
That's correct. The concept is same, the terminology, the meaning of it is same. So only the deductibles would change. If you are with a Blue Cross, there is a certain amount of deductible, and for the same coverage, if you are switching to a Kaiser or a Cigna or a Aetna, then your the cost would change, even though for the same services, because they have a different cost factor.
Right, I agree. Just for BS perspective, all this terminology is common. That's what I want to know.
Yep, exactly.
Okay. Thank you.
Okay, now that we have covered some terminologies, so we will go into some of these insurance coverages. The list, what you are seeing is the different types of, the list that we normally seek the services of the physician. Like now we go to a doctor, for a regular office visit or a physician visit, and if there is a severe problem, then you get hospitalization. If there is any procedure to be performed, then there are surgeries. Or if there is any rehabilitation, there's a physical therapy, occupational therapy. If you want to be on a drug, like a short-term, long-term, anything, there is a cost involved, so there's another medical expense. And most of these insurance companies, nowadays they are encouraging you to undergo this preventive health care, like enrolling yourself to any fitness center or a health program, anything like that. So, because they believe that preventive health care is much more cost effective rather than seeing a physician when the problem occurs. Then there's a lab test, there's a cost incurred by this X-rays, blood work, etc. Then there's a mental health, medical equipment, for if you are using anything. Then the rehab cost, dental, vision. So there's different types of costs, that you need to be making sure your policy or your contract with your insurance company covers. So that's just a list. Okay, so we will move on to our next topic, try to understand the different insurance coverages. So there are different coverages, if it is an individual or if it is in a group, if it is provided by your employer, or if there is another coverage called COBRA. So let us deal with individuals and try to understand what these coverages are. The individual health insurance, it is often used by the people who do not have the option. Like for example, as I said, if you are owning your own company or you are part of the employer group, but now you're no more with a job, so you're alone, right? So you need some kind of insurance. So for such type of people, then you have the individual health insurance. So this type of insurance is usually inexpensive. I mean, to start with, it's not expensive because you're single, and it encourages you. This is only to be used as a stopgap arrangement. For example, you take up any individual health insurance, and it is good for 3 months or 6 months, and up to a maximum of maybe 9 months. And later on, you will not be eligible for these type of health insurances, like an individual health plan. So these are highly tailor-made and specifically for a short-term purpose. So that you should keep in mind. And if you still continue on this, then the cost will be more. The second type is your group health insurance, I think, where everyone is familiar with. If you are working for your company, and then the insurance that is offered by your employer is called your group health insurance.